The Talking Mental Health project is around giving people the language to talk about mental health with each other, to notice if something is changing, either for themselves or for a customer. Also about giving people the tools that they need to follow up if they notice that someone might need some support.
I think it's really important to talk about and address older people's mental health because there's a high prevalence of social isolation, loneliness, and it can often be a hidden issue.
Over the past 6 years, when Uniting AgeWell has been developing its strategy, its number one priority is to have the client at the centre of everything we do. One key way of doing that is through our investment in research and innovation, and the outcomes of that work are to better the lives of the people that we serve and the broader community.
The co-design element is integral to developing any program that people are going to engage with. It was so good to have people who work in aged care, but also consumers, customers, people in different walks of life, different perspectives.
There was a co-design process that went through a number of months between our research partners and clients, staff, and from that co-design process an app was created, and it's part of the standard systems that our home care workers use. At the end of a shift, they report on any shifts or changes they've noticed in their ordinary work with their clients that the office might benefit from hearing about.
Home care workers are in a really important position to have open conversations and provide companionship and reduce social isolation for their client and look after kind of emotional well-being.
It's the coming together of multiple teams across Uniting AgeWell, plus outside the organisation such as NARI, ARIIA and Flinders University brought their wisdom, their skills, their enthusiasm. It's a real team effort.
Co-design is a reflection of what's been happening in healthcare in recent years, and that is to give the consumer a voice.
We're out on site in Victoria doing staff training for mental health and engaging with them using games and activities.
The Talking Mental Health project has made probably quite a difference to me. It's given me some tools that I didn't have previously. Maybe they don't always share everything about their mental health with their family or their close friends. So having somebody professional in their life to come in and talk to them and genuinely care about what they're doing and how their mental health is, I think is very important to them.
I was very sick and the cancers had changed me. Anthony had concerns about me, saying that I wasn't my normal self. You know what, it's really good to have someone else in your life that's interested in you, you know, and making sure you're all right.
We make small but important notes at the end of the shift that we record it into an app. It then goes into the office and is followed up further.
So it's added confidence for home care workers that what they say is being heard, and care staff to know that they can do the very best they can because they've got all the information they need.
We've seen a wide range of positive outcomes from this project. The one that really stood out to me was that we saw 24,000 reports generated by our home care workers. That means that we've had 24,000 opportunities to make a difference to someone's mental health. And 72% of our staff reported increased confidence in talking about mental health.
I think our programs, and more specifically the Talking Mental Health pilot, has been a huge success. It's empowered our home care workers to be able to communicate their observations, any concerns, any successes, and doing so directly with the office via the Talking Mental Health app on Procura has made a huge difference.
I'm quite privileged that someone was concerned about me, you know? Yeah, I felt special.